Hello, everyone. Thank you so much for having me here. My name is Heloisa Soares, and I'm a medical oncologist, and I'll be talking to you today about finding a NET specialist and managing second opinions. These are my disclosures. I do respect all the rules for my institution, but I have collaborated with these organizations. So first of all, let's just talk about a reality. We keep saying that neuroendocrine neoplasms or neuroendocrine tumors, that is the largest subgroup of neuroendocrine neoplasms, are rare, but they're not so rare anymore. You can see that they're increasing in incidence and prevalence, but they are still forgotten. And why do I say that? Well, there's about more than 170,000 patients living with NETs in the United States, but many times patients have all these symptoms and the physicians that they seek attention from don't necessarily know where the symptoms are coming from and how to manage, and if they are related to their neuroendocrine tumors, really what's the best strategy to make patients feel better. So if you look at the list of symptoms that patients with neuroendocrine tumors often live with, you might see yourself or a family member with the symptoms such as the fatigue, abdominal pain and cramping, the flushing, memory loss issues. How many of my patients say that they have memory loss issues since that their diagnosis and so forth? And you can see a constellation of symptoms that patients have described in this survey that has been done a few years ago. So you're really not alone in terms of how you feel about it. And yet you might find a lot of frustration in terms of finding best strategies to improve your symptoms and disease. So NETs are complicated, or neuroendocrine neoplasms are complicated, because you have to make sure that the team understands and you understands that tumors that are classified as well differentiated are very different than tumors that are classified as poorly differentiated. And this is under the microscope. So this is what the pathologists that have the tissue from your tumor is going to look and say, okay, this is a tumor that looks more similar to normal glands, or this is a tumor that looks extremely disorganized and is more consistent with a poorly differentiated tumor or carcinoma. And they tend to be much more aggressive and will be treated very differently. Thankfully, most of the neuroendocrine neoplasms or neuroendocrine cancers are well differentiated tumors that tend to be a little bit more slow in terms of the growth. Then after that, we divide them in grades. We say a tumor can be grade 1, grade 2, or grade 3. And again, this might play a role in how we decide on treatment for these cancers, and also in terms of your overall prognosis and discussions about that. And here's a table that we use for tumors that are coming from the GI tract in terms of separating them well differentiated versus poorly differentiated and the grade of the tumor. And one thing that we talk about a lot is the Ki-67, which is the index of proliferation of these tumors, or how fast the cells are dividing under the microscope. Then we think about NETs in terms of the site where the tumor initially started. For example, tumors that are in the small bowel, we call it their midgut tumors, and tumors that are in the foregut are typically the tumors in the pancreas or lung, for example. And we might decide on treatment strategies for these tumors a little bit differently. So again, that's important to take into the account when you have your diagnosis and the strategies that will be used to care and implement on your care. It's also complicated because some tumors are functional and other tumors are not functional. Functional tumors are tumors that are secreting hormones and peptides that can cause a lot of symptoms. For example, tumors that secrete serotonin, it will be translated to patients having a lot of diarrhea, and many times you also have a flushing associated with that. However, a tumor that is secreting insulin is going to manifest in terms of symptoms with patients having very low blood sugars. And tumors that secrete insulin, we will see in the pancreas. So just to give you a sense of how complicated the treatment of neuroendocrine cancers can be. Because of all this, obviously, I have to say, and I'm a strong believer on this, that neuroendocrine tumors require a multidisciplinary discussion and approach. And as a matter of fact, when few organizations and cancer centers look into this, they did see that patients that were referred from the outside institution or the community to center of expertise in neuroendocrine tumors, the diagnosis could change a lot. The staging of the patients that we're seeing in this big institution or specialized center was changed, and the grading of the tumors are also changing. Right here, if you look, there's about, in this particular study, 30.7% of the patients had a change in their staging due to this multidisciplinary discussion. And then when pathologists look at the samples and actually did a second read on the biopsy materials or the surgical materials, there was a change in the pathology grading of these patients in up to 17.9%. So it's truly key to have a multidisciplinary discussion in a center of expertise. And that, in fact, led to a change in clinical management in half of the patients. So taking a case, taking a patient presentation and discussing in a different center of expertise led in this study to a change in management in 50% of the cases. That's a lot. Why is also important to seek the advice of someone that is specialized in neuroendocrine tumors? Because when you look at the guidelines that we have for this disease, and this is the National Comprehensive Cancer Network guidelines, this is a very well-established guidelines group. They publish guidelines for many cancers, and insurance companies and doctors in the community that don't treat a particular disease for living 24/7 really look for guidance in how to treat diseases looking at this NCCN guidelines. And if we pick, for example, here, the NCCN guidelines for pancreatic neuroendocrine tumors that are well differentiated, if you look in the bottom, when you see, okay, you have a patient that is symptomatic and you have to start treatment, you start potentially with a somatostatin analog, and then later when you have to move to a different treatment, there is like 9 options, right? How do you choose? How does a physician that is in the community that maybe only see few patients with neuroendocrine tumors a year, how does this physician has the experience to decide which treatment is probably the best treatment among all these options, right? Is just some of this is a lot about the experience of seeing many patients with neuroendocrine tumors and having a feeling for the disease, having a sense of the burden of disease, and understanding the long-term history of the patient to decide when is the time to do a treatment and which treatment to choose between all these options here. Again, just to give you an example of how this disease can be complex and complicated, and then it's always helpful to have a group of folks waiting in of what's the best strategy. Too many options, right? So what's the best option? So I hope with all this is what I'm saying, you can understand when a net expert can help. So it can help in deciding if surgery is an option for you and what type of surgery is the best option for you, deciding the best time to start systemic treatment on your case. There are many times that I will see a patient and a second opinion, and given the particular presentation of the patient, I will feel that maybe we don't have to start the treatment right away. Or on the other hand, I see a patient that a colleague in the community has said, oh, let's just start with the hormonal shots. But when I look at the patient, when I hear the symptoms, and when I see the scans, I say, you know what, I think we need to do something a little bit more aggressive, if I may use the word, because we really think we should try to shrink your disease, especially in the case of pancreatic neuroendocrine tumors. One thing that we can often use right away is chemotherapies using oral chemotherapy drugs. There's also some looking and having a neuroendocrine expert on your side can help to figure out when is the best time to change systemic treatment. Sometimes even if the scans come back and say, we see disease progression, when you truly look at the scans, it might be very little progression that I wouldn't necessarily, as a net expert, feel that it's time to change treatments and perhaps you could continue in the same treatment, right? Is that often topic of discussion is what we see in the reports that the tumors are growing is truly clinically significant, and does it clinically matter that we really feel like we have to change treatments? Again, this is a marathon, not a sprint, right? So we need to use our weapons very carefully. Is also deciding what's the next treatment strategy if we have to change the treatment. What's the best modality of imaging that we should use in this disease? Should we follow a patient with MRIs? Should we follow a patient with CT scans? When is the best time to do a dotatate scan again? Do we have to do more often than not, and why, right? A net expert can help with all this. Also, there are many caveats and pros about dealing with symptoms, and there are strategies that, as a net expert, that we see patients with this disease very frequently. We have few tricks that might be helpful. This also helps with coordinating the care with your local doctor. And finally, identifying potential clinical trials that might be good for you. And why is that? When we try to find clinical trials for neuroendocrine tumors, it can be super overwhelming, right? If you go to the clinicaltrials.gov, which is a big database with all the trials that are open and available, there's so many, and it's hard to figure out which trial do you have in your region and which trial will be good for you. And it's impossible for someone that's not focusing on neuroendocrine tumors to know all these trials. So that's also when a net expert can help and say, you know what, I know about this trial and I think that trial will be good for you. And then suggest the trial and sometimes even help you to connect with the folks that are running that trial. So in short, I think multidisciplinary teams are key for the success. All these organizations, including the European and the North American neuroendocrine tumor societies, endorse the use of tumor boards and the multidisciplinary teams with a net expert. And there has been shown that this actually improves the survival of patients when expert teams are involved in the patient care. It also helps with trust. We know that patients with neuroendocrine tumors, they have often a huge issue with trusting their care providers. Why? Because sometimes it took so long for them to get a diagnosis, and they were reporting to their care providers that they were having cramping or diarrhea, and took several years for the diagnosis to finally to be made. So there's a lot of trust in the system, and there's a lot of mistrust in the system. And seeing a doctor that actually understands your symptoms and understands what you're going through can really help with reestablishing the trust. And reestablishing the trust can really help with you being compliant with treatments and therefore hopefully having better outcomes. Possible reasons to seek second opinions in general, that I mentioned some specifics for neuroendocrine tumors, but number one, you want to confirm the diagnosis as we talk about it. You want to also hear from experts that have this access to unique treatments, including the clinical trials that I mentioned. You want to hear about a different viewpoint in terms of how to manage your cancer, right? How many times my opinion can very much differ from a dear colleague that is also a net expert, and we just might have different approaches how to treat a particular situation. So you might just want to brainstorm with few people to decide what fits your needs and your goals. You might be doing a second opinion because your family member wants to do a second opinion. You might actually feel that you want to transfer care to a different team, and the first step is to seek a second opinion, and then depending on the outcomes of that, you might decide if you want to transfer your care or not. So these are some of the overall reasons why someone will seek a second opinion. And there are a few myths about looking for second opinions that I want to really clarify. Number one, many patients feel that the physicians will be upset if they hear that a patient is going for a second opinion. I don't think that's necessarily true. When my patients want second opinions, I encourage, I ask where they wanted to go. I ask if they wanted me to contact the physician that they are searching for upfront, or if they prefer that I really don't talk to them because they don't want to, quote unquote, be influenced and so forth. And then if a physician gets upset that you're seeking for a second opinion, maybe that's not the physician that you want on your care team. Also, many times patients might feel that it's very expensive. It's not necessarily. There are many insurance companies that will cover a second opinion consultation, at least for one time. And depending on the center that you are, the center might actually offer support for your travel. I can tell you that here at the University of Utah, with the NET Destination Care, we actually offer vouchers for patients to come from out of state to come and see us, vouchers in the sense of facilitating airline tickets. And then we have discounted lounging for patients. So it might be potentially less expensive than what you think. So if you don't ask, you will not learn about it. It's also difficult because there's issues with taking a long time to do appointments. You'll be surprised. Many of these big centers that have NET experts, they actually have a whole team that they can facilitate all this, including help with paperwork, helping with logistics, financial help, and so forth. So again, if you want to seek a second opinion, identify the center that you want to go to, and then ask which resources they have to facilitate that. It's a very good thing that's not life-threatening right now, but we want you continue to be healthy for a very long time, and perhaps having a second opinion to understand your long-term journey might be very helpful for you to continue to have a good health for many years to come, despite the fact that you have a cancer diagnosis. One thing that I want to caution is just be careful that you are not seeking like 7 or 8 different opinions and not actually acting on any decisions and delaying any decisions that might be important. So, few opinions are okay, but when you get to like your 7 opinion, that might be a little bit too much. And where to find a NET expert? Well, there's online databases. The NetRF has a database. There's many other organizations that have databases. You just have to make sure that you are looking at a database that is up to date and has some reliability, such as NetRF. Contacting organizations. Many of the patient organizations have hotlines that you can call and talk to folks from the organizations that might give you suggestion of experts in your area. And that might be helpful in the case that you don't want to travel too far. You can get referrals from other patients, right? Patients that you know are to bumpy clinic might say, I had a wonderful second opinion experience in X place. And even you can ask your doctor, if my patients ask me where I want to have a second opinion, who should I see? I'll say which states is easy for you to travel if you want to travel out of state. And then I can give you a few names or that particular state. And if there's no issues about traveling anywhere, I'll give you my 2 cents and who I think is worth to see in terms of what the needs that you need at that moment, right? It might be that I'm sending for a second opinion for surgery, or I'm sending for a second opinion in terms of deciding treatments or for a trial. It really depends of what the needs at the moment, but your provider or your clinician should be able to help you as well, in addition to what I mentioned above. And finally, please try to focus on finding a team that actually listens and cares. There's a lot of research that shows the importance of kindness in cancer care. And you should really seek a team that does deep listening and really listen to your concerns and the concerns of your family, that has empathy, that understands what you're going through, because that can help to decide the next steps of treatments, that provides care in appropriate timing, right? You have access to different tools and also different strategies to face what you're living through and helping with that are honest and will give you honest opinions and feedback, but in a very gentle way. You don't want a team that is going to say that everything is fine when things are not fine. Sometimes we need to have difficult conversations, but that can be done in a way that is not confrontational and can be gentle and candid. And then also a team that will understand your family needs and will support your family caregivers. So try to keep these characteristics as well in mind when you are looking for your NET team. So my take-home message is, find a cancer care physician that you trust. It doesn't need to be a NET expert, but you have to trust that physician. And I say cancer care physician because you could be be seeing an oncologist, or you could be seeing a surgeon or endocrinologist or a gastroenterologist. I think for most of the patients, they typically see a medical oncologist. If your local physician is not in a NET cancer or a NET specialist, consider a second opinion in the appropriate place, do your homework, be your advocate, and really keep the open communication with your local doctor and use reliable sources of information. As much as I love social media, sometimes might not be the best place to seek reliable advice. And finally, after you have your second opinion, really ask clearly to your specialist how these recommendations will be communicated to your local team. And that's what I have. Thank you so much for listening. And you know how to find me here. Thank you. Take care.